Hi, I'm Dr Ramona from Oaks Dental Ruislip. I'm a general dentist and I enjoy restorative dentistry, prosthodontics and cosmetic dentistry. I'm going to be running this course at Medimatch on copy dentures, so please visit our website for more information. Step 1. Select a disposable impression tray which easily accommodates both the denture and the duplicating putty. Step 2. Mix the duplicating putty place it into the tray and then push the denture into the putty with the denture's fitting surface uppermost. Top tip, try and avoid contact between the denture and the tray because this makes sure that the putty is moulded to reach the full depth of the periphery of the denture. Step 3. Once the putty is set, cut 2 or 3 locating notches. Then apply a thin layer of separating medium, such as Vaseline or baby oil, to the cured putty surface. Step 4. Mix enough putty to form a good base for the mould. Push a small amount of the mixed putty onto the fitting surface of the denture to prevent voids forming between the denture and the impression material. Place the remaining putty on a hard flat surface and press the denture into it, engaging the V-shaped cuts created in step 3. Top tip, make sure there is sufficient putty used to create a substantial mould base. This prevents a potential distortion during the processing in the laboratory. Step 5. When the 2 halves of the mould have set completely, you can separate them and carefully remove the denture. Record the required tooth shade, which you can then place on your laboratory form. Clean the denture and give it back to the patient. Step 6. Trim any excess putty from the mould periphery. Inspect the mould carefully, ensuring that there's no air bubbles or voids and that the impression is faithfully reproduced all the features of the denture. Ensure both parts of the mould locate accurately together in one position. Place both halves of the mould in a disinfection bath. When you remove the moulds from the decontamination bath, rinse them under running water and you can seal them in a bag ready for the lab. Make sure you fill in your laboratory form fully and arrange for the laboratory to collect. The lab now creates a wax copy of the old denture using the impressions provided. Top tip, the dentist must indicate on the lab form if the copy denture is to be constructed entirely in wax or if an acrylic base is also required for additional stability. An acrylic base try-in provides a more stable and accurate platform for taking the reline impression.